Welcome to the show, everybody. Thanks for joining us. I'm Micah with CoronavirusDiaries, and again, we are blessed with Dr. Andrew Scarbrough, a clinical psychologist that is currently practicing in Minneapolis, Minnesota. Dr. Scarbrough was kind enough to jump onto our show in his free time, and he's going to share a little bit of insights into psychology and
thanks for having me back, man.
Yeah, I appreciate it. So, Dr. Scarbrough, why don't you just jump into it? You got this topic. It sounds really, really cool.
Yeah, I've been seeing a lot of patients with pre-existing mental health issues. And it kind of struck me today as I was talking to people with like OCD and depression and social phobia and various types of anxiety disorders. I was like, oh, like there's people that are getting new symptoms who didn't have these symptoms before. And I had the thought, the coronavirus is going to take out people, unfortunately. It's going to infect a lot of people. A few people will die because of it. But I think a lot more people are being infected by mental health symptoms out there. And that's going to be something that everybody is going to experience. We're week 1 and week 2, maybe depending upon where you are, into this shelter in place order that a lot of states have going on. And, the stir craziness is setting in. A lot of the behaviors, I wanted to list a few of them, if that's all right.
Yeah,
so
please.
There's something called mesophobia, where you're really kind of obsessed about germs and cleaning and things like that. And I'm thinking there's a lot of people out there. One of my colleagues was putting Purell on for like the 50th time that day, and he was like, I think I'm giving myself OCD. And I think there's a lot of people out there doing that. Think of the hoarding behaviors associated with anxiety. How many people are hoarding various things in their pantry right now? Sure. Quite a few. Think about, avoiding the outdoors. There's a whole condition called agoraphobia, where people avoid the outdoors. You can go outside and take a walk, but a lot of people aren't doing it. They're feeling subconsciously, isolated, like they have to sort of stay held up in their cave, in their safety zone. Social distancing. Social phobia. There's a little bit of a social phobia thing going on with people too. When you see another person out in public now, you're very aware of it. It's like, like a little primal, like you see somebody and you're like, oh, there's a potential threat now.
Yeah, it's a little bit of 6 feet, give me space.
Yeah, there's hypervigilance about that. I was going to my apartment office today to pick up a package, and I met a woman on the staircase, and she like walked down the staircase quick and got out of the way. And I was like, oh, she's being cautious. But I was like, that's, like we would have come within maybe 3 or 4 feet of each other. And I'm not judging her for this, but it's a kind of a little bit of a start of a symptomology. And then you have people with thought disorders, these like obsessive thoughts, another component of potentially like OCD. And how many people spend time catastrophizing about what happened if this, if my loved one gets this, what happens about my job. And some of this is reasonable.
That's a lot of the stuff we talked about in the last session from last week. Yeah.
At a certain point, it becomes counterproductive and it becomes detrimental. You're taxing your mental faculties so much by worrying about this that it's actually serving as a detriment to you, being overly cautious, overly prepared. And by no means am I suggesting that people are developing OCD or, an anxiety disorder or depression. But I do think there's some symptoms here. And I want to make that clear, that it's not a clinical disorder necessarily, although some people probably will develop clinical depression or an anxiety disorder because of this. That's a fact. Some people will develop that because of the isolation. But a lot of people, I would say most people, are going to check a couple boxes for mental health symptoms in the weeks to come as this continues to go on.
Is there a certain type of a set time, or that was actually a conversation I was having with somebody today about, the first week or so roughly of self-isolation with families, right? So I talked to somebody that mentioned that in terms of crime, it sounds like there's more domestic calls. People are being pushed into environments together for longer periods of time than they're used to. And I'm questioning how long until, how long would it take to develop like something that's clinical, right? Like depression or anxiety from this? Is there a set time?
It's different for everybody. If you're a really social person, it might happen to you quicker. If you're used to isolation and you're kind of a loner, it's going to take longer.
So all the video gamers out there, they're good to go.
Yeah, I've met some people too who are kind of introverts. They're like, this, I was made for the coronavirus. Like I was made to sort of stay held up playing video games and eating bad food and not talking to anyone.
So I wanted to jump back to you had commented on hoarding as like a behavior type thing. And I'm curious, in psychology, where is the line between being prepared and hoarding? Is it the types of like the toilet paper thing that's a dead horse, man. We can beat that all day. But in terms of like food, vitamins, like just the basic things, clothes,
I would say as the standard rule, it's whenever it impacts your day-to-day functioning in a serious way. So if you think about, I have so much crap at my house that I can't walk around, right? Or I've spent so much on supplies that I don't have enough to pay rent or utilities or other things. I've spent all my money on this particular thing. When it gets to that point, I think it's a problem. There's a funny sort of twist. Another one that I was thinking about, how there's a lot of good PSAs out there about the importance of hand washing and people, maintaining social distance, and that stuff will save lives, in my estimation. I absolutely believe that it will, but I also wonder, long term, what are there people that are going overboard in these things? And I want to say that, like, there are people, I know people who have a family member who has a condition or several conditions where if they got this, it became over basically for them.
Yeah.
Because they're sort of
very,
very poor health.
Yeah,
I don't think those people should refrain from, being overly cautious, because the consequences are very, very serious too. But a small example would be like somebody who is, repeatedly and without really good reason, like lathering themselves up with Purell. They're like chronically avoiding going outdoors because they're afraid that somebody will cross their path and cough on them or something like that. And somebody that, might not have serious consequences. A surprising amount of people are more, I've noticed, are more concerned about getting it and passing it along to somebody than they are about their own safety. I guess I'm not too surprised, but that's
pretty much where I'm at too. Is I've come to know a number of friends that have diabetes, and there's a parent of a friend that also has diabetes, and that's the big thing, is just knowing that, right? Like, I would hate to be that person, but unknowingly,
Nobody wants to be the carrier that brings the harbinger of death.
The harbinger, yeah. With the OCD thing, or diagnosis, I'm curious. So I was questioning the other day if I'm like getting borderline, like out of control, because personally, like, I'm kind of getting to a point where I'm almost like, I want to just get this and get it out of the way. Like
I said that 2 weeks ago.
if I knew I could just, like, if that's it right there, give it to me, and then I'll just stay in my apartment for 2 weeks. Hopefully, then it's over. Hopefully, like, roll the dice. 80% is a pretty good, roll for me, and that's maybe a little wild to say, but I'm sitting here because I'm in a small building with other people. I don't know their conditions. I don't know really anything about them. I just moved in here literally in the middle of the pandemic. I moved, but I've got a small amount of these viral hand wipes, right? And so every time I'm coming into the building, I'm using them on the doorknobs and the handles, and like wiping my keys down and coming in my house, and then I'm washing my hands. And it was getting to where, like, I remember not too long ago, I had been cooking chicken with a friend, and I had like raw chicken all over my hands. And then I went to the sink, and I put like the cutting board in the sink with the raw chicken. And then I realized there was like raw chicken juice on the table. And like, I just started, it was like borderline. I was kind of like, there's salmonella everywhere, and like kind of a weird joke. So now that's what I liken COVID to, is like this chicken, like, but you can't see it. So it's just kind of this weird.
It reminds me of, if you ever got a wood tick, I'm sure you have, right?
I mean, we're Minnesotans, so
yeah. So you get that thing where you find a wood tick and you pluck it off, and then you start feeling something crawl on your back or other parts of your body, and you're like, oh no, it's your brain playing tricks on you. You're overreacting. You're being hyper vigilant. So like a bead of sweat or a small twist in your clothing that causes a sensation, you're thinking it's a tick crawling on you.
Right.
And I had something like that too, that I was pressing the keypad to get into the security door at work, and the little paper towel I was using to push it like slipped off, and I touched the key with my bare finger. And I was like, oh no, surely that key had the COVID virus on it.
I know, right?
So I like walked in and I squirted the Purell container right inside the door, and it was out. And I was like, oh no. Like I was walking around holding my finger out, like the COVID finger.
Yeah.
And like I stopped, you know, about 20 seconds later, and I was like, all right, I found some Purell. And as I was like lathering up, I was like, man, you know, like that one key, look at the reaction you have. Like, be cautious. You know, maybe that key did have the COVID virus. But I'm saying, like, it's going to play tricks on people. It's going to play tricks on their mind. And I think a little bit of that is probably better. I heard somebody say that if we wait until it's really bad and then we say, okay, we got to tighten up measures, it's already too late.
Yeah,
if it seems like we're overreacting to the situation, that's the time when you can actually, like, the extreme measures are going to do something.
Yeah, I mean, you can.
And I was like, that's true. Yeah.
You can see what's going on in New York now. Their numbers are starting to surge a little bit. Nothing like Italy or Spain. And, you know, a lot of the talk right now is about New Orleans and the fact that they did Mardi Gras and there's 1 million people smashed in the street together. So that's roughly 2 weeks from the end of Mardi Gras is when New Orleans is anticipated to be surging, and you know, time will tell. I know there was some people in my network that thought that it was a little ridiculous what was happening in Minnesota, and the common theme that everybody would use would be like, well, does anybody know anybody that's actually died from it? It's like, well, no, because there's 2 people that have been documented in Minnesota that have deceased from it. But, you know, that doesn't mean that in 2 weeks from now, there's not, you know, a lot more happening. So I like the, you know, if it seems like you're overreacting, you know, with this particular strain of coronavirus.
And I think people, like, you go ahead and overreact. That's the err on the side of caution, you know, do that. But I do think that some critical looking at the things that you're doing to try to prevent some mental health symptoms and some deterioration of your mental health is a smart thing to do. And that's all I'm suggesting. Sorry, what's that?
Let's jump into that. The you had talked about you know, like hoarding and agoraphobia and OCD and some of these diagnoses. Can we just step through briefly? And just kind of touch base on how to push against that.
Think about, I'll go down the list. I just wrote down some of the symptoms to kind of keep me a little bit focused here. So the excessive cleaning, the over cautiousness with that. Think about your applications of Purell or the amount of hand washing you're doing. You know, like, do your 20 seconds if you want to, like 2 happy birthdays, or, you know, like, yeah, definitely put Purell on after you've been, you know, places. I put surgical gloves on when I went to the gas station because I was like going inside and I was handling the gas pump, and I was like, yeah, I don't feel like that's being overly cautious. Be cautious, but if you find yourself doing stuff like in clean zones, I guess, like I feel like once I cross the threshold of my place, like that's pretty much a clean zone, right? And I've seen people like in my work, like past the security doors, everything's sanitized after each patient. Everybody's clean, yet surfaces sometimes feel like they're dirty. Like everything feels like it's dirty. Right. And just think through it and think about how many times you're doing it, and think about the times when you need to do that, and think about the times, and not everybody's doing this, but there's a few people out there that are repetitively doing these things mindlessly as a way to seek comfort. You know, you feel a little bit of relief when you start lathering up that Purell. You're like, okay, I'm good again, right? Sure. Just like the person with an anxiety disorder, you know, is checking the locks so many times. They feel good. They're reinforced by that behavior of that checking of that lock, just like people are being reinforced by the lathering of the Purell. Just think about the stuff that you're doing critically, and like, is there a function to it, or am I doing it for comfort? And that would be the same thing with hoarding. Think about how, like, I think a week of supplies is reasonable. Like, do it. But you know, is that
What about a month?
month? No, you know, I have about a month. I could stretch it to a month, but
Like for a family, let's say there's a family.
I wouldn't say that's unreasonable, but I would also say it kind of depends on circumstances. But are you doing it out of necessity, really, or are you doing it out of comfort? You know, are you doing it because if you look at the people who are you know, running the food distribution centers, they're saying, like, we have food for you. You will not run out of food. We promise you that. You will have food. You don't need to run out and do that. We have toilet paper. We do have toilet paper. The reason you can't buy toilet paper is because everybody's hoarding it. And so I think, you know, collectively it's not going to happen, but it'd be nice if everybody would say, like, okay, let's just buy what we need, like a week at a time. Like you and I, we were talking, like, we kind of lived like week to week or less, you know, in terms of
I mean, in
the fridge.
I was moving, so I was like, I'm not going to carry a bunch of stuff. But, you know, to that point, like I basically ensured that I had around a month of supplies that could be stretched, right? Like if I wanted to stretch the rice and the beans, you could do it, but it's not necessarily going to be like the most ideal. But for me, the reason that I did that, the bigger reason was that I didn't want to be going back, you know, like I didn't know what was gonna, in my mind, I'm like, they could do a lockdown where, you know, they start doing, like, who knows, you know, like I was thinking in the event that this thing turns into wildfire and it's out of control to where they're quarantining a city, there's military checkpoints, which they are doing in some countries, you know, there is martial law in a number of countries.
I got a letter today that will give me permission to be out on the streets.
It's real, man. It's real. My mom got that letter too. That's, you know, essential businesses must go on, keep the economy at least semi-floating.
If everybody, though, you know, just kept buying the way they normally had, nobody would be like struggling to get toilet paper.
No,
I believe that's probably true.
Here's something I'm curious about, and then I know your time is valuable, and we're coming up to that 15-minute mark. So in terms of the food and the supplies that I have here, right? Mm-hmm. I was noticing yesterday that so I've got enough canned foods. I'm just kind of like, and it's easier than, you know, say making rice or beans and like making a full meal, right? But when I opened the can, I remember thinking like, I'm using my supply. And it was a real thought that went through my head that I'm like, and I'm dipping into it, right? Like I got it with the intent that I wouldn't have to go to the grocery store for a couple of weeks because I don't want to be a part of the strain on the system. I did this, you know, quite a while ago. But
I think that's good, man. I really do. I think that's a good thing. I started doing that too as a way for me to sort of take a step to not, to a small step to not be so anxious. Yeah. You know, I had one of those weird catastrophizing thoughts about touching something, and I thought about it, and it was kind of irrational. And so I was like, "Oh, you touched your face. What are you gonna do?" And I rubbed my eyes, and I was like, "All right, if you got it, you're getting it. You're getting the coronavirus now. You're rubbing your eyes." And I kind of felt better. It's like a weird little exposure technique. But if you think of, like, if you're hoarding a lot and you throw some stuff away, like, you're on this path to get past your hoarding. If you're deathly afraid of germs and dirt, part of the exposure therapy process would be like, for example, this would be one part of it, but like pick up some dirt and hold it in your hand, rub dirt on your hands. Like that's part of getting over it, right? So I've cut into my supply. Yeah. I'm diligent. I don't think anybody would, you know, if they were to follow me around, they'd be like, oh, that guy's not being irresponsible. But I'm not, I'm being very mindful to try to not to let my being smart and cautious turn into something that is way over compensatory and creates like excess anxiety in me. That's
sure. Yeah, it's definitely, you know, we're only a couple weeks into this, and, you know, as of yesterday, the governor said it's official on Friday, the lockdown goes into place. And then what really does that mean? None of us really know, other than people like yourself and some folks that I know that got that letter that's going to allow them to, in theory, get through checkpoints if they set up checkpoints.
I think once this goes into effect here, not a lot is going to change because everybody was kind of already doing shelter in place. Like you weren't like going out for fun. People kind of were going out for if they needed something or they had like a job that they needed to work at. But I think maintaining social connections and getting outside, you're not confined to your house. You can go take walks. Just don't go have a big barbecue with a bunch of people out in the park. Like, don't hang out in groups. Like, I think there's going to be a tendency, like, that people develop. That's, and again, I'm not saying people are going to turn into agoraphobics, like where they are afraid of leaving their apartment or their house or whatever. But I am saying that over time, people will start to subconsciously maybe adopt this sort of like sheltering up in their home, like there's something bad out there. There's going to be a feeling like there's something bad. I need to stay protected in my shell. And I think getting out and taking walks, like I'm going to try to force myself to get out and take walks every single day, even during the shelter in place. And I'm going to make sure that, you know, I'm maintaining contact, not just with patients, because I'm doing virtual visits, but I want to make sure that I'm maintaining contact with you, you know, with family members, with friends, people that staying in contact with. So I don't start slipping into this withdrawn, isolated, inactive state. If you get isolated, withdrawn, and inactive, you're going to start to develop depression. Nobody is impervious to that. It's just a matter of how much it's going to hit you and how long it's going to take to get bad.
So how about that? That's great points, and I appreciate it. To cap this session off. So it sounds like one, maintain communications outside of just, I don't know, like a video game doesn't necessarily count. It sounds like.
Yeah, video games don't count.
Right. So maintain communications, get a little bit of exercise, be aware of your health and your nutrition, and basically be aware of your actions. Like, what are you doing, and is it impacting your day-to-day routines in your life outside of the normal COVID-19 impact? Am I missing anything?
No.
I kind of glazed over at a very high level, but yeah, this is good. I like it.
Well, thanks for having me on. I appreciate it.
Yeah, Dr. Scarbrough.
Nice to do these. Yeah.
It's a pleasure as always. Anybody that's new to this show, Dr. Scarbrough will be joining us weekly. We'll be touching base on things periodically that are, you know, hopefully relevant while we're all dealing with this COVID-19 pandemic. So until next time, thanks again, Dr. Scarbrough. It's been a pleasure, and everybody else. If you got questions, leave them in the comments below. We want to open this up so that it's live, so that if people have questions, you've got a practicing clinical psychologist, you have access right to them. So throw stuff down in the comments. If you're interested, we'll respond back to you, and we'll get the information out to where you can be a part of the live session. So thanks again, Dr. Scarbrough.
Thank you. Nice to be here.
All right. Later, everybody. We're out.